when I look at the industry all across this country, it's clear that there are many that are caving in at this point in time. So I will tell you this, from a financial point of view, is about the worst that I've seen.
In the initial stages of the pandemic, we were under a great degree of stress.
Fatigue, exhaustion, high staff turnover.
The load has been very heavy. Our teams are tired.
We are now looking at 2.5 years later at how do we move forward post-COVID in a healthcare world and in a financial world that's changing dramatically.
One of the things that we're facing now is really some of the financial pressures on health systems and hospitals, and there's many reasons for that.
Our labor costs have gone through the roof. Pharmacy costs continue to outpace the rate of inflation, and a flat or decreasing reimbursement rate. The math doesn't add up.
The amount that we pay for supplies, that's gone up 30% over the last 3 years. The average hospital right now is losing money.
I think we're really on that edge of trying to figure out, are we as a healthcare system throughout this country going to be able to survive?
It is inherent in healthcare workers to provide care. They go into these roles to help people. They want to help someone. And some of these financial pressures are really making it hard to do that.
So if you are trying to offer 24/7 STEMI coverage, or if you're trying to offer 24/7 orthopedic coverage or intensivist coverage, there are real costs there. And if we don't address that sooner versus later, we may, as an organization, both locally and in a macro sense, have to cut back on these services.
One of the other things to consider is the impact it could have on health equity and health disparities. Access to care may be curtailed in our most important facilities that are serving some of our most vulnerable populations.
Over the course of the last 2.5 years, Congress, our country, has really stood up to support hospitals and more than hospitals, our caregivers. We've survived for 2.5 years. We've staunched one set of bleeding, but there's a different set of bleeding that is going on right now.
Folks need to know, both on the Hill and in local and state legislative branches and government, that this is a major issue. This is impacting not just a few hospitals, it is impacting hospitals across the country.
It's ultimately about viability, stabilization, and sustainability. We need resources so that we can remain the essential provider for our communities.